believed to be an autoimmune condition where the beta cells in the pancreas are destroyed by the immune response. Genetics and environmental factors, along with exposure to certain viruses like mumps virus, rotavirus, is believed to play an important role in development of type 1 diabetes. While dietary or lifestyle habits of your child is not a cause for type 1 diabetes, parents need to be mindful of what their child is eating. Everything your child eats can affect their blood glucose levels, so meal planning is crucial. Working with your doctor or a dietitian can help you formulate a better diet plan according to your child needs. When you have a child with type 1 diabetes, you might be tempted to try the diabetic diet, but in truth, there is no particular diet for diabetes. The nutritional needs of the child with type 1 diabetes is as same as the one without diabetes. A balanced diet with nutrient-rich food, but the only difference lies in maintaining the blood sugars in normal range in type 1 diabetic children. Three primary nutrients, fat, carbohydrates and proteins, affect your blood glucose differently. Carbohydrates are quicker than fats and proteins in entering the bloodstream. Carbohydrates take about 1 hour after consumption to enter the bloodstream and about 2 hours after consumption to leave the bloodstream. So remember to check your child's blood glucose just before the meal and after 2 hours of the meal. And fats do not affect blood glucose significantly. It only slows your digestion. So your child might have a high blood glucose level after a high fat meal. Proteins do not affect blood glucose levels. It might only be seen if the child is eating more than what the body needs. Knowing the number of carbohydrates in your child's meal plays an important role in the insulin dosing. So, working with a certified diabetes instructor or a professional dietitian can help you count the carbohydrates in your child's meal. And the number of carbohydrates in your meal can be easily calculated. Usually, the packaged foods, the label contains the number of carbohydrates per serving. If the food doesn't has a label, your dietitian can help you with counting the carbohydrates. Diet of a type 1 diabetic child should include about 50 to 60% of carbohydrates, 25 to 30% of fat, and 10 to 20% of proteins. Including a wide variety of nutritious food is important. For example, fresh vegetables, fresh fruits, dairy products like cheese or yogurt, eggs, lean proteins like chicken, poultry or fish, nuts, seeds, lentils or whole grain foods, or high fiber cereals like oatmeal. Limit intake of high fatty food, especially the ones containing saturated fat like burgers, chips, bacon or butter. Always be careful of sugar-free or fat-free foods. They are high in carbohydrates. They can contain sugar alcohols that might result in rise in blood glucose. And avoid sugary drinks such as aerated beverages or flavored waters. Unsweetened lemonade or sugar-free drinks is a better option. To conclude, timing and planning of meals are necessary tools to manage the blood glucose of your child, ensuring that your child is getting the required nutrition. Additional planning is required for special occasions like birthdays or festivals where there are more sweets or candies. You can allow your child to eat a sugary food but limit carbohydrates in other meals. Having diabetes doesn't mean that you or your child should avoid specific foods. It is only a matter of consistency in your child's meals and choosing food that is lowering your blood glucose level.